So this is what we call a trichoscopy report. So we just did a patient we had seen, I believe, I guess the previous time I saw her was in April. So we're able to compare reports. You want to always know if something you're doing, like I said, in the old adage in medicine is what you measure, you can treat. So we measured her previously prior to certain treatments of medications, regenerative medicine, and what we found was parts of her system, like the middle of her scalp and the back of her scalp, have dramatically improved, whereas the front has really not changed as much as we had hoped. So with the area under the curve, she's gotten up about 30% on her middle of her scalp. In this area, this is the area under the curve, and this area went from 9,000 over 12,000. So she's really gotten denser in the middle and the back. So she's responding well there. Now, you keep in mind, this is only April till now. So we measure hair in years, not in hours, minutes, or days. So do I think that the treatments she's doing are helping? Yes. Do I think we can still add more? Yes. But you always want to start slow and go slow, because you do not want to over-treat someone. If she only needed X number of things, then we would only give her X number of things. We don't want to give her X, Y, and Z all at once. The final problem, or not problem, the other thing that we have to keep in mind is what happened between April and now, especially in a female patient that would have also characterized some of these changes. Has she had any surgeries? Has she had any travel? Has she had any weight loss? Has she had any treatments to her rest of her system that would have happened, like a pregnancy or something like that? And so if we do this, at least we have objective reasons to now ask the questions. Well, what's going on here? And then we have now newer options to say, listen, we really need to focus our efforts on getting that frontal portion and the middle portion maybe a little bit better. The back, we've done a pretty decent job, and what we can do now is focus our attentions a little bit more. So that would be the value of having this type of software. Not everyone will have this type of software, but it allows me to do also things like look at an area a lot closer. So I can see whether or not there's inflammation around a hair follicle. I can see that there's a little bit of inflammation between hair follicles, and this is likely because at some point we had used some cortisone because she had some inflammation there. There's also some hormonal shifts starting to happen here that we can start to see. There's a little bit of dandruff in certain areas that we can also see, but we don't see areas that are extremely inflamed, except with maybe this exception in this area of the hair. So trichoscopy gives us a lot more detailed evaluation of a patient's scalp. It's not to say that it's the end all and be all of what I'm going to do, but this, with the proper history, with the proper understanding of change over time, gives us the ability to really understand this patient and to give her the best options.